Hello, my name is Shauna Welch. I'm the Regional Director of Talent Acquisition, and I have the privilege of leading the recruitment team that hires the best talent from around the country and from within our communities. Employees often share with me when they join the Mercy Health team, it feels different. They say they don't know what it is, that they can't put their finger on it, but they know that it feels friendly and welcoming. In fact, our employees take great pride in our hospitality, and this is evidence of our culture. Our culture is based on 5 core values: reverence, commitment to those who are poor, justice, stewardship, and integrity. As a member of Trinity Health, the second largest Catholic healthcare system in the country, we share these values with all of the other member organizations, from Maryland to California. Our culture comes alive in our people. Here's what some of them have to say.
Mercy Health, when you enter the door, there's a feeling about the organization. It feels like family. The people are fabulous. The relationships are strong. There's a strong relationship between physicians and nurses and pharmacists, the interdisciplinary team, and an amazing relationship between the medical staff among themselves and the medical staff with the administrative team.
My ICU team, we rock. We're just a good team. We're just good, good people. We help one another. We have passion for each other. It's just like we were like a family, just we're meant to be.
I was really pleased just by the amount of teamwork and by the enthusiasm that everyone had. All the nurses seemed like they loved where they work, they all worked together. That's what initially drew me and has really kept me here all these years. So.
I think the mission here is what really makes a difference for me. We talk about in our mission caring for the patient's body, mind, and spirit. And as a nurse, that's really what nursing is all about. We help to cure the body, but we also tend to the mind and the spirit. And my belief is that you really can't fully heal as a human being without tending to the spirit as well. And so the mission really speaks to who I am as a nurse and a leader in this organization.
It's a faith-based organization, but it's really around the people. It's about the relationships. It's around integrity, honesty, and really caring for not only those we serve, but those in our community who need us the most.
I really like that we just not care for the individual concern that brought the patient in, that we're caring for the patient as a whole. You have a chaplain coming to asking if you want, to have a visit from them. You're being asked, how are you feeling? Are you depressed? Are you having any other concerns?
I was actually drawn to Mercy Health when I was a paramedic. We have experience going from hospital to hospital throughout not only West Michigan, but the state. And I got a lot of experience getting the idea of what each hospital is like. And Mercy Health, St. Mary's was different. It stood out to me. The culture here was better. The atmosphere was more comfortable. The doctors, nurses, they're all more friendly here.
We've worked very hard at making sure that we hire the best people. What we're looking for is somebody who cares from their heart, and that's visible, that people feel like they are being treated as a real person, that someone is fully present when they're asked to speak to somebody or patient asks for something, they feel like they're listened to. It has to come from the heart and soul.
Mercy Health really values what a nurse brings to the healthcare team. Whether it be bedside nursing or in leadership or management, or now more than ever in the primary care area. I think that nursing is really valued. And secondly, nursing is really respected here at this organization throughout our system. There's a lot of programs that support nursing as a profession. We have scholarship programs, we have shared governance. Nursing is really a respected and valued member of the healthcare team at Mercy Health.
The CEO who was here when I began 12 years ago, that was one of his goals, was for the organization to become magnet designated. And so really had to do a lot of education about what it takes to be a magnet designated organization. It really is about creating a culture where nurses love to practice and that they really can feel like they're practicing to the full scope and that they have some autonomy over their practice, that they are driving their practice, that they are part of making a difference, that they are part of impacting the work environment that they practice in.
I feel very very valued as a nurse here because of that magnet designation. Nursing is very highly respected here. Our opinions are respected and heard and acted on, and that is something that I very much value.
The physicians that we work with are easy to talk to, from the anesthesiologist to the surgeons. They do listen to us because we're the ones who are taking care of their patients.
Oh, our physicians are great. You know, we are their eyes and ears, and they rely on us to communicate changes in our patients, and they rely on us to be in those rooms and to be their front line. My providers, my doctors, my PAs, my nurse practitioners, they listen because they know us and they trust us, and they say, okay, let me see that patient, let me go in there.
As we bring in new nurses, we like to grow them. We strive to make sure that they are professionally developed to whatever level they want to be. We love nurses who want to stay at the bedside, and we do everything to provide them the education and the ongoing support to do that. We have a clinical ladder that has 5 levels that nurses can progress through. We support them through tuition reimbursement. We support them through offering education on site and also offering the opportunities to go to national conferences as well as state conferences.
It's one of the things that I chose Mercy Health for, because there is other employment opportunities, there's an opportunity to grow.
Many nurses know that they want to work in OB, or they want to work in pediatrics, or ICU, or ED. And we have all of that at Mercy Health. We have open heart program, we have a huge vascular program, orthopedics program, OB. So we've got all the specialties that a nurse may want to consider when they graduate from nursing school. So lots of opportunities for nursing in varied specialties.
I love working at Mercy Health. Once again, the people I work with, a great group of people. It's just a fun place to be.
I enjoy my job at Mercy Health. Well, it's rewarding. They can get the experience that they need. It's challenging. I won't tell them, I won't lie. It is very challenging, Some days we have, difficult days. But through it all, if they get a team like I got, they'll enjoy it.
I'm especially proud of how we identify who will be successful in our organization. Our evidence-based hiring practice is among the most innovative in the country. If you're curious about Mercy Health, I invite you to connect with us at mercyhealthcareers.com or email us at careers@mercyhealth.com. See for yourself. We look forward to meeting you.